Hello, this is Dr. Do again. This video is still on alphabetic list problems. Finish the letter R and move on to letter S. So today I'm going to talk about the sinusitis, which is so common. And also this sinusitis, the official term should be the rhinosinusitis. So it's, but I just use it as the first letter of S. Sinusitis. So let me just bring up the emergency situation associated with this sinusitis. Again, if the sinusitis is deep enough and cause the extended to the brain, of course, alter the mental status, high fever cannot be brought down by medications and the chills, and also alter mental status and headaches, severe headaches, and so if that's the case, it's really emergency. But usually, the sinusitis, majority of case, the sinusitis was managed by was caused by the virus. So can you manage at home? I think you need to talk to a physician, even though the diagnosis might be the virus, or the management may be observed for a couple of days without knowing whether it's caused by bacteria. So if that's the case, still you can just use supportive measures, but still need to be diagnosed and exclude serious problems. So so that's the minor of sinusitis, not an emergency. In terms of the sinusitis, we know the rhinosinusitis actually is always part of the upper respiratory tract infection. Majority of cases are caused by the viral. So by the way, we have 4 sinus around the skull. The purpose of sinus is to lighten the weight and also increase the resonance of the sound. It's kind of cushioning the air also, sometimes buffering the mechanical force to the brain. So this is probably the purpose of those sinus. The most common cause of sinusitis are the viral, actually. More than 90%, 95%, they're all viral caused. The difference between viral and also and the bacteria caused sinusitis is the symptoms, whether you have systemic symptom or the color of the drainage. So this is if it is the nasal discharge was white. So usually it's the mucus. If the mucus is white, usually it's caused by the viral. If the color change, the yellow or greenish, that's pretty much by the bacteria. So this is for the young children. However, sometimes the sinusitis could be caused. Majority of case, many cases can be caused by the Haemophilus influenzae bacteria. So that's in young children. For adult, for normal adult, the bacteria sinusitis may be the strep, most common one, and also could be the Haemophilus also. And for those who had chronic sinusitis or who had systemic disease, might be some other bacteria, particularly if the swimmer, for example, Pseudomonas, or immunocompromised, the patient also have the Pseudomonas is probably another cause. And also chronic can be the staph, just the normal floral in the skin. So this is about the cause. In terms of clinical wise, the presentation, you probably know severe nasal congestion, completely blocked sometimes, and also feel heaviness on the skull and headache, and sometimes may have the pain on the facial bone if you press it. However, this I think a couple of decades ago, the diagnosis of sinusitis is the bone pain, facial pain, the facial bone pain. But now I think it's proved lack of sensitivity and specificity. However, there's some sinusitis do have this kind of presentations. So this is about the symptoms. Of course, rhinitis is part of it. The inflammation of the nose, either caused by either the redness and inflammation, or the polyps also can be associated with this sinusitis, rhinosinusitis. So this is about the presentation. And in terms of treatment, pretty much the initial diagnosis could be acute, less than 4 weeks, or could be chronic, or could be recurrent. Depends on the situation. There's a criteria to diagnose. Usually it's clinical, unless there's a doubt or unless suspicious that the sinusitis is really involved in the brain. So if that's the case, the imaging study probably is another choice. And in terms of the difference between viral and bacterial, initial treatment will be observe, actually supportive care to keep the air moist, and also warm the air, keep the air warm and moist, and also fluid and symptomatic management. Couple of days later, or usually about a week, if still not getting better, probably start to use antibiotics. So because majority of case of the sinusitis is was caused by the viral. Actually, sinusitis probably is one of the conditions with overuse, overprescribed antibiotics. However, if a couple of days or a week, still the symptoms were not going away with the symptomatic management, that probably the nasal congestion is getting worse, or the drainage start changing color. That's probably need to see your physician again and then start about antibiotics. Of course, you probably know that the most common used antibiotics is the augmentin, either low dose or high dose. Depends on the severity, depends on the possibility of compliance, or usually it's the same. There's no compliance issue, just the dose, some preference from the physician, I guess. Somebody like to use low dose, and somebody like to use the high dose. Of course, the severity of the sinusitis is one of the most criteria to choose the medication. So this is about the sinusitis. Again, for those who had either a swimmer or immunocompromised, that is probably sometimes the condition might be serious. You really need to see your physician at an early stage when you feel nasal congestion very severe, feel heavy on your skull, and also severe headache. That's the case. See your physician, the sooner the better. And also the children. If the young children, your parents, they do not say it, but you can sense it, the heaviness, the resonance of the sound is kind of really echoing, and the voice sounds like a thick. So if that's the case, you probably need to bring the child to the physician, because there the bacteria can be really cause serious complications if not managed on time. So this is about the sinusitis. It's simple, straightforward, but it's so common. And the complications in terms of management could be very simple, straightforward, recovered with supportive care, or could be very serious. So that's why I started the first video under the letter S, sinusitis. So I'm going to stop here, and thank you for watching, and I hope it helps. I'll see you next time.